HIV is a virus spread through certain body fluids that harms and weakens the immune system. HIV can eventually destroy an abundance of the CD4 cells so that the body can't fight against infections or diseases. These special CD4 cells partner with the immune system to help fight off infections and diseases. And when these cells are untreated, HIV tends to destroy them, making it harder to fight against infections or diseases. Diseases such as cancer take advantage of a very weak immune system and detect if a certain person has AIDS, which is the last stage of HIV infection.
HIV stands for Human Immunodeficiency Virus, which can lead to AIDS immunodeficiency syndrome. If not treated properly, AIDS, unlike other viruses, cannot be treated to get rid of it from your body. Once you get HIV, you have it for life. Some of the history of the infection/disease began where scientists believed that HIV originally came from a virus particular to the chimpanzees in West Africa in the 1930s and was transmitted to humans through blood while hunting. However, it wasn't until the 1980s where doctors and the rest of the world became aware of HIV and AIDS.
That's good. Some of the minor symptoms of AIDS include nausea, vomiting, persistent diarrhea, chronic fatigue, rapid weight loss, cough and shortness of breath, recurring fever, chills, night sweats, rashes, sores or lesions in the mouth or nose, on the genitals or under the skin.
The test. A healthcare provider can do a blood test on you and check to see if you have AIDS. The test looks at different antibodies and antigens in your body. With that information, the doctor can distinguish if you are HIV positive or HIV negative. The main test is called the ELISA test. It stands for Enzyme-Linked Immunosorbent Assay. It is the most accurate test. Other tests you can take are called home tests and the saliva test to determine if you're HIV positive or HIV negative.
HIV attacks a certain immune system in your body known as the CD4 helper or T cell. When HIV destroys that cell, it makes it harder for your body to fight off other infections. HIV destroys CD4 by a replication machine that creates new copies of the virus in a never-ending loop. Eventually, HIV will kill enough cells to the point where it is too hard to fight off any infections or invaders. This disease affects the whole body, and it causes many problems with the most vital organs and systems.
At this time, there is no medical cure for AIDS, but there is a treatment medication that can help fight HIV and the complications that will reduce HIV in your body. However, many of the medications for HIV lead to different complications throughout the body, and some of these symptoms can be fatal.
HIV research has come a very long way since when they first discovered the disease in 1980. A method of therapy called antiretroviral therapy may be the biggest outbreak in current research so far, as it has saved millions of lives. Furthermore, one very advanced treatment seeks to inhibit the replication of its RNA, preventing the virus from duplicating and reproducing. Most scientists are not sure when they will have a cure for HIV. However, they say that the goal is to finish a cure by 2020. They have found many treatments and are on the verge of achieving a cure.
One in every 5 people ages 13 to 24 have reported to have AIDS in 2014. AIDS can be gotten from many things like mucus, blood, broken skin, wounds, kissing, and intercourse. However, HIV typically is more common with adults, especially adult men, and 16% of all new diagnoses of HIV are among individuals over 50.
HIV or AIDS has a very negative impact on someone's life, as it makes them too unwell to be able to do regular activities. Acute HIV is the first stage of the infection, and it causes flu-like symptoms. However, once someone develops the other two stages of either chronic HIV or AIDS, it becomes extremely difficult to do anything. HIV can definitely change someone's life, as it may cause major fatigue, depression, eating problems, and severe muscle aches or pain every day. While it can also prevent you from living a normal life, as it has negative brain effects such as dementia and seizures.
as you need to maintain your whole body every day, and the drugs needed are extremely expensive. It is said that the average cost for HIV treatment per year, which includes drugs and therapy, is around $14,000 to $20,000. The drugs are very effective and keep people alive for decades. However, over this time, HIV treatment can cost in the hundreds and thousands of dollars. As for the cure, it is to be unknown right now. That the price number is also unknown because it is not developed yet.
HIV virus/infection weakens the immune system very impactfully, and because of the infection, HIV or AIDS has a huge negative impact on the respiratory system. HIV increases the risks of colds and influenza, and without treatment, HIV allows a greater risk of infections and complications such as pneumonia and tuberculosis. This occurs as the airborne bacteria affects the lungs, causing chest pain and a lingering cough that causes blood and phlegm. Furthermore, HIV can cause major problems in every component of the upper and lower respiratory tract. The lower the CD4 cell count, the more prone to all these different complications a human would be. These complications can occur in the upper tract and can be problems such as acute sinusitis, acute pharyngitis, and laryngitis. Lower tract complications include bronchitis, recurring bacterial pneumonia, fungal pneumonia, and disseminated tuberculosis.
HIV infection can cause severe problems to your circulatory system as it affects your blood right away. Firstly, HIV affects the health of your blood vessels and your heart. Your blood has to be monitored regularly. There are many conditions humans may obtain if they are infected with HIVs and are caused with HIV infects, which have chronic inflammation and more lipase on the arteries. This creates clots and causes plaque in the arteries to build up, preventing blood flow. For example, HIV increases the rate of hypertension, especially in the pulmonary arteries, and over time it'll most likely cause a heart strain. Heart strains can lead to more lethal problems when someone has HIV, such as congestive heart failure and cardiovascular disease, in which branches out into all kinds of different problems and complications with our heart, such as a disorder of the nodes with arrhythmia, heart attacks, and cardiac arrest.
HIV or AIDS negatively impacts your digestive system as well because of a typically weak immune system. An HIV infection can directly cause oral thrush, which is inflammation of the tongue covered with a white film. Smaller problems such as inflammation of the esophagus and mouth ulcers are much higher tallied for people with HIV as well. These problems with the digestive system tract lead to decrease of appetite and make it very difficult to eat as well. However, it isn't just the upper part of the digestive tract that gets infected or troubled by HIV. For example, HIV can cause the filters of your kidneys to become inflamed, making it extremely hard to remove wastes from your bloodstream. Some very serious problems can occur if HIV-infected person consumed contaminated food or water, as they can get salmonella or parasitic intestinal infection, which affects the bile ducts and intestines severely, making it hard to digest food properly, resulting in chronic diarrhea, abdominal pain, and vomiting. HIV makes humans much more susceptible to all kinds of infectious agents that mainly affect the digestive system, such as viruses, parasites, fungi, and many bacteria. Another topic to mention would be how HIV infections are related to diversity, as HIV is one of the worst viruses that humans have discovered. It is very virulent and very harmful to the human body as it causes many diseases. HIV consists of two identical single-stranded RNA within its core of the virus's particle. All viruses can come in different shapes and sizes, and HIV tends to become a cone shape with an average diameter about 120 nanometers. Likewise, another characteristic to describe HIV would be that it has an envelope or an outer membrane. Another relation to diversity is that HIV was first discovered as a virus for non-human primates, such as chimpanzees, and has developed into one of the most fatal viral infections that humans suffer from. Viruses mainly are transmitted to different humans through blood and body fluids, and is said to be the same for when it is transmitted from primates to humans. The last topic we have to talk about is how HIV relates to cells. HIV or AIDS is not a cell, as it does not carry out cell functions, is too small, and doesn't generate metabolic energy. It is a virus, and it may not be related to cells, but it affects them massively. HIV attacks and infects certain types of white blood cells in the immune system, which is the CD4 cell. Once it fuses with that cell, HIV replicates itself and starts to release a lot of HIV into the blood. This is all a part of the HIV life cycle, as it continues to wipe out more and more CD4 cells. As I've said previously, the less CD4 cell count you have, the more prone you are to receiving many infections and diseases all throughout your body, whilst the HIV infection progresses into AIDS.